How's it going, guys? Medium difficulty question for pathology, micro step 1, internal medicine, 2CK. 52-year-old man, vitals normal. Physical exam shows erythematous plaques on his back and arms. They're non-pruritic. Auschwitz sign is negative, which means it's not psoriasis. That's bleeding of the silvery scales when you attempt to remove them. Blood smear shows cerebriform shaped cells. Virus most likely responsible for the patient's condition is most taxonomically similar to which of the following. So this blood smear here is showing us this cerebriform shaped T cell. Okay, so if we try to hallucinate as far as what we're looking at, this basophilic means purple. This is the nucleus. Okay, and it apparently looks like brain gyri. You don't need to know this image here. I just threw it in here to be a flagrant asshole. Okay, but what you do need to know is this very buzzy descriptor in a vignette. If you see cerebriform shaped cells, you know right away that we're referring to mycosis fungoides / Sézary syndrome. Let me explain. So this image here showing us the erythematous plaques. This is called mycosis fungoides. It's a T-cell lymphoma, a cutaneous T-cell lymphoma, where if you biopsy these plaques, you'll see T cells with a characteristic cerebriform shape. Okay, the literature gives you a mix of the cells being cerebriform versus the nuclei being cerebriform. Doesn't fucking matter because that word means mycosis fungoides / Sézary syndrome anyway. So this cutaneous T-cell lymphoma, it's a diagnosis of exclusion. Okay, so common things are common is the expression. You don't want to go chasing weird, rare diagnoses immediately. So you say, okay, well, it's not eczema, it's not psoriasis, right? And you can narrow your differentials down. You say, okay, mycosis fungoides is a possibility. If it extends to the blood as a T-cell leukemia, we now call that Sézary syndrome. Okay, so Sézary syndrome is the T-cell extension to the T-cell leukemic extension to the blood. Now, the image in Sézary syndrome, 50% of the time it'll look like this, just a mycosis fungoides, erythematous type of plaque photo. The other 50% will be diffuse erythroderma, which basically means it looks like an old dude who got out of the sauna and he's bright pink. Okay, just everywhere in his skin is bright pink. That's the other image they can show you, erythroderma, okay? So this is Sézary syndrome, a cutaneous T-cell lymphoma, mycosis fungoides with the blood leukemia extension, Sézary syndrome. So it's caused by HTLV, human T-cell lymphotropic virus. Let's just hop through the answers. Choice A, adenovirus, wrong fucking answer. So this is viral conjunctivitis, 19 out of 20 times. Can also cause hemorrhagic cystitis, 1 out of 20 questions, all right? But DNA virus, non-enveloped, double-stranded linear. Wrong fucking answer. Choice B, coronavirus, wrong fucking answer. So, okay, I mean, RNA virus, helical nucleocapsid enveloped, single-stranded positive sense, non-segmented. Garbage virus, wrong fucking answer. Choice C, echovirus, wrong fucking answer. So, this is the most common cause of aseptic meningitis. Aseptic meningitis, aka viral meningitis. So if we were to ask you about which it's a RNA, icosahedral nucleocapsid, single-stranded positive sense, non-segmented, non-enveloped. But if we were to ask you what's the most common cause of bacterial meningitis, you'd start naming off different organisms. You say, well, it could be strep pneumo, it could be Neisseria meningitidis. You'd give me various bacteria. So if I were to say, well, what's the most common cause of viral meningitis, you'd say, actually, I have no fucking idea. Well, it's echovirus. Wrong fucking answer. Choice D, HIV, correct answer. So HTLV and HIV are both RNA viruses. Icosahedral nucleocapsid, enveloped retroviruses. Okay, so they're both retroviruses. That's how they're grouped together. If you think it's weird or nitpicky, don't know what to fucking tell you, all right? You can also know that apart from mycosis fungoides / Sézary syndrome for HTLV, HTLV can also cause an obscure condition known as tropical spastic paraparesis, which is antibodies against neurons. So if they give you someone living on the South Pacific Islands who has some recondite neuronal degeneration over 6 months and it's caused by a virus, it's going to be HTLV. Let's just hop to the final answer choice here, measles, wrong fucking answer. So I mean, I threw it in here as an obvious distractor because we have clearly skin lesions, and you know measles causes a maculopapular rash. But measles is going to be RNA virus, helical nucleocapsid, single-stranded, negative sense, non-segmented, Paramyxoviridae. Wrong fucking answer. You know the deal. I'm going to make more content. I feel like my stuff's for my channel. I appreciate your time. That's it.